all of San Benito County, Merced County, and parts of Madera, Fresno, and Stanislaus County. It's a large agricultural district. So thank you very much for the opportunity to speak with you here today. And let me just underscore, when I say a large agricultural community, one of the biggest challenges that we have is access to healthcare and any kind of healthcare services in many of our isolated rural cities. And so it's one of the reasons why I'm so passionate about access to healthcare and doing everything possible to try to create opportunities for people to get good services. So I was asked to speak today about a bill that I've introduced, SB 365, which would require Medi-Cal to reimburse all participating primary care providers, including those who operate out of a FQHC or a RHC for eConsult services. eConsult services are really a patient-centered innovation, and quite frankly, because of the pandemic, have become increasingly important. They offer timely resolution for patients who may otherwise wait weeks or months to see a specialist for something that may not require an appointment in the first place. Currently, eConsult services are reimbursable for providers at the distant site, and these are usually the specialist providers. However, the primary care provider at the originating site is not able to bill for this telehealth service. Both the providers are bringing expertise and information to the table when discussing the patient's condition, but only the specialist is reimbursed for their time. In fact, it could be argued that the primary care physician is going above and beyond by e-consulting with the specialist, regardless of whether the patient is eventually referred. If the patient is referred for an appointment, the specialist now has background on the patient's condition, and the visit can be spent on next steps instead of information gathering. And if no referral is needed, then the patient will have their questions addressed within days. Thanks to this form of telehealth, either of these outcomes benefit the patient more than a simple referral with no provider-to-provider contact. This type of communication would be a great benefit to rural residents, as I mentioned, where access to healthcare in general has been a long-standing issue. In my own district, it can be difficult just to get an appointment with your general practitioner at the local clinic, let alone a specialist appointment, since specialty care is stressed in all sectors of the healthcare industry. The closest specialist may be hours away for a rural patient, and for someone without their own transportation or access to healthcare, this type of healthcare visit could be most challenging, and data indicates that many patients don't seek follow-up specialist visit. I've heard from some of the primary healthcare providers that up to 60% of the patients that they make a referral on never actually end up using the referral service for all of the reasons that I stated before. Use of an eConsult would determine if a physical visit is in fact needed, saving rural patients time and money. This also gets the patients concerned addressed more quickly for non-urgent medical conditions. SB 365 is, really a relatively small change to the billable telehealth services in Medi-Cal. And I believe the bill will not only create equity for the primary care provider, but most importantly, will improve care for the patient. With the many challenges to telehealth services that we have seen come out of the administration, eConsult services is continually left behind. I introduced SB 365 as a mechanism to close that gap. So thank you, and I look forward to working with you on this issue. If there are any questions, please feel free to contact Michelle Canales on my staff. I believe she's on the call right now, and she's been doing tremendous work in our office on behalf of this particular bill.
Thank you so much, Senator. As you know, we have a project that is starting out in the Central Valley eConsult Coalition, where Anthem, Blue Cross, HealthNet, and Calviva, along with a large number of FQHCs, are spearheading eConsult. So we really appreciate your support for this, especially in the FQHC setting. Do you have a moment for any questions?
Sure.
Wonderful. So we do have a letter of support. As you can see on this slide, we're asking our eConsult workgroup members in California, if they wish to support, to sign that letter of support and send that off to you. Is there any other way that we should be supporting this bill that is visible and helpful to you? in your presentation of the bill.
Well, what I've always found helpful is the members of the Senate as well as the Assembly respond better to a bill if there are interests in their communities that are interested in it as well. So if you have members that have that are in California that are willing to consult or call their Assembly member or their senator, or to send them an email, any kind of communication is really helpful to say, I'm in your district, this is really important, we'd like you to support it. That would be tremendously helpful.
Thank you so much, Senator. And Michelle has really been shepherding this through for us and helping us with fact sheet and language and supportive documentation to help educate our group on this. So thank you, Michelle Canales, who's also on today. And Senator, if you need to leave us, we understand you're tight on time. Anything else, Michelle, that can be helpful? We're going to provide this letter of support. Are there any other means of support we can provide to you and the Senator in communicating this bill?
Hi, Libby. Thank you so much, Senator. Just getting that letter of support in the next 2 weeks or so. That'll be critical for our first committee hearing. But thank you guys so much for taking a look at it. And we really hope that, with your support, this bill will go far.
Great. We're asking for the letter of support from our eConsult work group members by March 5th, and we'll remind you of this deadline. Senator, I was wondering if there is a public hearing, if there's any participation that you'd like from us, or if there's anything else that you know around timing of the bill.
Well, there will be a number of hearings. This will start off in the Senate, and we'll have a. I don't believe, Michelle, we've got a date scheduled yet.
That's correct. It has not been scheduled yet for Senate Health.
It will be scheduled probably in March, and we can be in touch and let you know what that date is going to be. It is part the hearing includes public comment, and so there's always an opportunity to have the public make comment. And it's relatively easy to do now because you don't need to travel to Sacramento to do it. You can do it electronically. So if anybody wants to sit in on a health committee hearing and make a public comment that would be really terrific. That'd be great.
Thank you, Senator. We had one last question from Robbie Franceschini. Go ahead, Robbie.
Yes, thank you, Senator, for your time. One last question. I think many members on this call would be interested to know what other senators have co-sponsored this bill, and are any others maybe interested in co-signing this bill or sponsoring it with you?
Yeah, we haven't made the big push to get other authors to join us here in the California Senate. That you're a co-author. That usually happens through the public process. So as I move through the committees and go to the floor, that's when members will join. But I expect that we will have a number of members that'll join us.
Excellent. Thank you.
Thank you so much, Senator, for your time today. I know that you are off to your next meeting.
Yes.
Michelle, if you have a moment to stay with us, that would be wonderful. Thank you so much.
Thank you so much. Bye-bye.
Michelle, did you have any words in closing?
Yeah, so I just wanted to say we did have a couple co-authors come on very recently. That is Senator Dolly. He represents District 1, and that's the very, very top of California, Northern California. It's a huge district, pretty spread out from the border all the way down almost to Placer. And then Senator Wiener also came on as a co-author. He represents parts of San Francisco. So we have gotten a little support, but the senator is right. As this bill moves through committee and other senators hear about it and vote on it, that's when we usually get a lot more support. So just in closing, thank you all so much. If you have any questions, I can go ahead and put my email in the chat, and you can feel free to contact me or contact Libby, and we can get any questions answered.
Thank you again for your time, Michelle. Really appreciate you getting the senator to join us today. And those of you who aren't in California, you can see here we have our bill language for the primary care provider FQHC reimbursement support. If you'd like to use that as model language in your state, we welcome that. And Michelle is providing her email address, and you can always get to the senator's office through me too. So thanks again, Michelle. Really appreciate it.
Thank you so much.
I rushed right to our senator since we wanted to make sure to be cognizant of her time. Those of you who've just popped on, we were glad to have the senator presenting State Bill 365 out in California. For those of you who are joining for the first time, we have a good number of people on our call today who are new to our eConsult work group. And we really appreciate your taking your lunchtime, or if you're on the East Coast, taking your afternoon to join us. We meet on a monthly basis. We have our eConsultWorkgroup.com website where we share publications and best practices on electronic consults. And we just keep an eye out for what comes out through academic publications and media around eConsult. So what we noticed last month, we were just very pleased to see coming out of Harvard Medical School and Brigham and Women's, Michelle S. Lee and Vinod Nambudiri of Harvard are going to present today on eConsults for safe and equitable coordination of virtual outpatient specialty care, with a specific focus on how eConsults is being used, or can be used, or considered at least, for response to COVID. And so many of you are on the front lines. I can see a number of providers today. We know how busy you are, so thanks especially to you who are taking time away from your COVID response to listen in today. So I'm going to jump to that and hand off to you. Before I do that, though, I did want to give a call out to our sponsors: Anthem Blue Cross, Arista MD, SafetyNet Connect, ConfirmEd, IHP, Rubicon MD, and Wise Healthcare, who are those who help us to be able to work with our states, with our payers, and to really look into legislation that supports reimbursement for eConsults. So our sponsors are those who make that work possible. And also a thanks to California Healthcare Foundation, who does sponsor this overall effort. So thank you to you all. And without further ado, I'm going to hand off to you, Michelle and Vinod. And if you wouldn't mind introducing yourselves, and I will click through your slides. You can just say next slide. So go ahead.
Wonderful. Well, thank you so much. Thank you so much, Libby, for the a wonderful introduction and for the invitation to present today. It's nice to meet everyone virtually. My name is Michelle Lee, and I'm a fourth-year medical student at Harvard Medical School and a research assistant in the Department of Dermatology at Brigham and Women's Hospital. I can let Dr. Nabadiri say a few words to introduce himself before we get started.
Thank you, Michelle, and thanks everyone for having us here today. We're very excited to have the opportunity to join the work group, share some of our thoughts, and look forward to actually having a discussion and hearing from all of you about some of your insights. I work in the Department of Dermatology as well as in the Department of Internal Medicine at Brigham and Women's Hospital, and am interested in the ways in which technology is changing the way in which you deliver care. And so eConsult sort of falls right up squarely into that alley, and look forward to speaking with all of you here today.
Great. So as Libby previously mentioned, we will be presenting today on how eConsults can help to provide safe and equitable coordination of virtual outpatient specialty care, particularly in the context of the COVID-19 pandemic. And as a bit of additional background about myself, I first got interested in eConsults about 3 years ago before medical school, when I was doing research with Dr. Barnett, Dr. Tiva Rocha, and Dr. Paul Gibney, who I know are sometimes on these calls, interviewing primary care physicians in the LA health system about their perceptions of eConsults. So it's great to kind of continue this line of work, but now see it more from the specialist point of view. So to give a bit of a roadmap for our presentation today, we will first give a bit of background about specialty care delivery during the pandemic, talk about the landscape of eConsult use at Mass General Brigham, which is the umbrella healthcare system that Dr. Nambudiri and I work under. We'll introduce this concept of eConsults as a method of delivering safe, efficient, and equitable coordination of care. We'll talk about limitations of eConsults, discuss a few illustrative eConsult patient cases, and then end with some time for discussion. Next slide, please. Great. So as most of us are aware, delivery of specialty care has become increasingly important and also challenging during the pandemic. We know that many populations still lack adequate access to specialty care, which can result in preventable morbidity and mortality. And what we've also seen during the pandemic is that many of the patients that have traditionally faced barriers to healthcare access and specialty care are also those who often are most at risk for adverse outcomes from COVID. We've also seen during the pandemic increased volumes of consultations and referrals for COVID-related consultations to pulmonology and infectious diseases, and also consultations for other medical management of conditions for patients that do not wish to come into the office. And finally, this aspect of safety has come to the forefront because we would like to find a way to deliver safe specialty care to our patients without the unnecessary exposure to COVID-19. So in the context of this delivery of specialty care during the pandemic, eConsult has come to the forefront. And to just give a background of what eConsult has looked like at Mass General Brigham, which is the health system that Brigham and Women's Hospital falls under, already before COVID, there was a pretty robust system of eConsults in place. So this is some data pre-COVID. We already saw that over 200 specialists had completed eConsults across 47 specialty services for a total of 45,000 completed eConsults. So there was already a very robust system in place, but it wasn't operating at completely full potential. And if you go to the next slide, we can see what happened after the pandemic started. So this is based on a paper written by some of our colleagues at MGH, Mass General Hospital, which showed how eConsult usage changed during the pandemic. We see that eConsult proportion, the proportion of visits that were eConsults went from under 10% before the pandemic, as illustrated by the blue line, to about 20% and above after the pandemic. So clearly there was a very large uptake of eConsults. Next slide, please. Looking within dermatology specifically, we saw a similar uptrend in the use of eConsults. So this is a paper written by some of our colleagues at MGH in the dermatology department, and we see that comparing eConsult usage before COVID in April 2019 to the first months of the pandemic in April 2020, the absolute number of eConsults increased from 163 to 196, and the proportion of all visits that were eConsults increased from 2% to 10%. We can see that this is graphically represented on the right here, where this green bar shows the total percentage of asynchronous visits, which includes both eConsults and also e-visits, which is another type of asynchronous visit where the patient directly submits photos to the dermatologist. So from these last couple of slides, we can see how the Mass General Brigham system dramatically increased its usage of eConsults during the pandemic. And we think that while a lot of the conversation around specialty care delivery has been focused on live synchronous video visits as a mainstay of specialty care, we should give more attention to eConsults. And eConsults can serve a particular unique role in the coordination of care, given the nature of how it is structured. So in this perspective paper that Dr. Nambudiri and I wrote, we talk about how eConsults accomplishes this across 4 main different axes. It can help improve relationships and communications between providers. It can help improve education for referring providers. It can help increase access to timely care, and it helps accomplish safe delivery of specialty care. So we will go through all these facets and then give a couple example cases. So first, during the pandemic, there have been increased challenges to communication, given that care has often been more fragmented and there's less in-person communication. So what we know from the literature is that eConsult can really improve communication between referring providers and specialists through this ongoing dialogue about the management of patients. We've seen in studies that PCPs overall have positive perceptions of this communication they've had, and specialists as well have reported an overwhelmingly positive perception of the communication through eConsults. We do want to recognize as well that there are some downsides, and some of the things that I heard when I interviewed primary care providers in my previous study were that specialists can sometimes be seen as gatekeepers to getting an in-person visit. The communication can often feel impersonal, and there is some variation in the quality of the specialist reviewers. But we feel that overall, there is this positive potential for eConsults to facilitate communication and relationships between providers. Next slide, please. A second aspect of how eConsult can help to facilitate transitions of care, particularly during the pandemic, is through education of referring providers. And we see that this continuing dialogue with the specialist can help improve the referring provider's knowledge and management of their specialized conditions, and can in turn help to ensure that there are more informed and standardized referrals. There have been a lot of studies in the literature showing the educational value of eConsults for referring providers. A lot of the studies have been done by Dr. Liddy, who presented in our last series. And we see that the overwhelming majority of PCPs who use eConsults believe that there is educational value. And most of the value has been for trainees and clinicians who are earlier on in their practice experience. Within dermatology specifically, there's also been a study surveying, it's actually still on the same slide, surveying providers, PCPs who used eConsults in dermatology for a year. And the PCPs, after 1 year of using eConsults, had increased knowledge of dermatologic conditions, and they also reported increased confidence in diagnosing and managing these specialized conditions in dermatology. Something that Dr. Namadiri and I have also written about is this importance of adding eConsults into graduate medical education, which has been increasingly relevant during the pandemic when there are fewer opportunities for in-person learning. And there was one study done at the Boston Medical Center which showed that eConsults really increases and improves educational value for medical trainees during the pandemic. If you go to the next slide, you can see that a framework that Dr. Namadiri and I helped to adapt for how to integrate eConsults into education. And based on the acronym eConsult, we came up with these different approaches. I want to point your attention to the letter T, which stands for teamwork, which represents identification of other relevant members in the patient's care team who can benefit from knowing the results of the eConsult. And this demonstrates how not only does eConsult in itself provide educational value for clinical knowledge, but also helps trainees to learn how does eConsult help to facilitate coordination of care. How does this communication fit into the larger picture of working as a team in medicine? And thank you for the positive feedback on the acronym. Next slide, please. Perhaps one of the strongest arguments for using eConsults, particularly during the pandemic, is this aspect of equity and timely specialty care. So as we previously discussed, there are tremendous health disparities that have been exacerbated during the pandemic. And we know that eConsults is a way that we can decrease the time to specialty input for fields, including dermatology, which can traditionally have pretty large and long wait times. Dr. Barnett did a study which showed that the wait time for dermatology input decreased from about 4 months to a little over a month. And in the context of the pandemic, this is very important to both ensure that patients get timely specialty input, but also that the in-person visits are allocated to those who really need it, to avoid anyone unnecessarily having an in-person appointment and potentially exposing themselves to COVID-19. The question of equity is also essential, and many studies in the past have shown that patients who utilize eConsult, who are treated through eConsult, are largely more non-white, tend to be enrolled in Medicaid at higher rates. And Dr. Liddy also published a nice paper on specific vulnerable populations that can benefit from eConsult usage, including patients who are homeless, patients who are elderly, and that may have more difficulties navigating through the healthcare system. But something we would hope to get everyone's feedback on later at our discussion point is how everyone has seen eConsults impacting equity in their health systems. Next slide, please. An important consideration we wanted to bring up is burnout. And we know in the context of the pandemic that medical providers in particular have been quite overworked, stressed, oftentimes have had more administrative workload. And we realize that these are some of the considerations that has been brought up in terms of eConsult, as well as increasing administrative workload, shifting some of the burden of specialty care more to the referring providers. We want to be cognizant that these are certainly considerations. Dr. Namadiri and I wrote another perspective paper on how eConsult not only can potentially exacerbate burnout, but how it can mitigate burnout as well. So if you go to the next slide, there is a kind of summary that we laid out for 3 different aspects of burnout that are in the literature. Autonomy, so how much providers feel like they have control over their time. Competence, how much providers feel like they have a skill set that's being used and improved. And relatedness, which is how much providers feel that their relationships with each other and their patients are being positive. So in terms of autonomy, we recognize that there is this increased workload, but on the other hand, this improved access to specialist input and decreased wait times can potentially liberate time for providers to be spending elsewhere and improve the sense of efficacy and ability to achieve desirable outcomes. In terms of competence, while eConsult, still on the previous slide. In terms of competence, while eConsult may be seen as a checklist that requires less clinical judgment and is more of, can provide more hoops to jump through in order to get a referral and in-person visit, we have seen this tremendous educational value, which we've already discussed at length. And then finally, in terms of provider relatedness, while there are potential negative interactions between providers who use eConsults, there's also tremendous potential to improve communication relationships between providers and also the provider-patient relationship through better outcomes for patients. This is another topic that we would love to hear more about in the discussion on everyone's perspectives on how eConsult has affected burnout. Next slide, please. We do want to recognize some potential barriers to eConsult on both the individual level, including this increased workload, concerns about privacy, technical challenges, reimbursement issues, and then also on the systems level, including licensing requirements, infrastructure, and this lack of integration across electronic medical health records. But we hope that we are able to highlight enough benefits of eConsults that providers and healthcare systems are willing to take on these barriers and consider them in implementation. Next slide, please. We wanted to close out before discussion with some sample eConsult cases, which are examples that we have seen in our own health system from our colleagues and also within dermatology for how eConsult can have utility, particularly during the pandemic. So this first case is a 44-year-old man who's otherwise asymptomatic, but has had 3 weeks of a persistent positive COVID PCR test, and unfortunately needs a negative COVID test to return back to work. The question is this something that the PCP would need to refer the patient to infectious diseases for an in-person visit, or is this something that can be handled through eConsult? Case B is something we have seen within dermatology. So an example would be a 32-year-old woman who is otherwise healthy and who has noticed a few days of skin color changes to her toes, concerning for possible COVID toes, but is otherwise asymptomatic, has a young child at home and is hoping to avoid unnecessary clinic visits. So the PCP can, instead of referring the patient directly to an in-person visit for dermatology, submit photos to dermatology to get some input. And then the last case, which we thought was illustrative of the utility of eConsult, is a 78-year-old man with many comorbidities, including diabetes, hypertension, cardiac disease, who's also uninsured, who has worsening heart failure and presents to his PCP for management of his heart failure. If the PCP feels that he or she needs some assistance and advice in managing the cardiac medications, one option would be to refer the patient for an in-person visit with cardiology, or he or she could avoid an unnecessary visit and potential unnecessary exposure to COVID-19 by submitting an eConsult. And we are open to hearing folks' feedback on these cases and any other cases that people have seen that have been particularly useful in the eConsult context. So with that, we hope that we were able to provide an overview of why we think eConsults are particularly important for facilitating specialty care delivery during the pandemic. And we hope to get general feedback on anything that we discussed, as well as some specific topics around eConsult and its contribution to burnout, either positively or negatively, how eConsult affects health equity, and again, any thoughts on the cases of eConsult presented.
Thank you so much, Michelle. I'm going to ask Delphine Tuo, who is on the call today. You may have met in the past. And Delphine, do you want to share your comment?
Sure. Thanks, Libby. And thank you for that presentation. It's always nice to see eConsult disseminate and do across the United States. So thank you. I think I just wanted to point out that while many of the publications around eConsults have been among vulnerable populations, so Medicaid populations in particular, as Michelle mentioned, I do think it's important to keep in mind that it really should, well, I'm a big proponent, but it should be standard of care for everybody. It is helpful. It is one lever we can use to achieve equity for populations that don't have as ready access for specialty care, but I don't want it to be thought of as just a tool that can be used among our vulnerable populations.
Thanks, Delphine. I want to just offer this up to our providers who are on, and I want to note that Delphine Tuo, Dr. Greg Buchert, who you can see on our screen here, Dr. Paul Gibney, you may wish to show your face also, and in addition, Dr. Lisa Arfons, who are on today. These are our clinical advisors who we look to for advice. They have deep experience in running eConsult programs, both from the payer and the provider side and across counties. So I'm going to pick on you all just to maybe, I'm not sure if Dr. Gibney might want to speak to this one, considering rolling out eConsult response or COVID-19 response across LA County. What are your thoughts on burnout? Is this something that we might be able to to incorporate into a process to reduce burden on either primary or specialist providers?
Yeah, thanks for the question, and great to see you on video, Michelle.
Nice to see you too.
Yeah, you did a great job on that previous article and study. It's funny that you talk about burnout in the context of COVID. I mean, for providers that have been not only working, insanely hard during surges, but also for, healthcare leaders that, and all of us that are experiencing the blend of home and work, and the workday never really ends. We just fix dinner and go back to work. Burnout is a big part of this. I have found for our teams that because so many of our providers are doing so much more via phone and video visits, the primary care providers are, that they are actually using eConsult quite robustly for co-management. Before the pandemic, they would often just be looking to move a patient through their clinic and maybe have a lower threshold for just trying to get them to the specialist. And they really bought into this need to co-manage patients, understand the patient's hesitancy or fear. And actually, I think conversely, it has actually helped them with burnout because they feel less. One aspect of burnout is just the task, right? Doing the task, the hours that are required to do the task. But another part of burnout is feeling isolated, feeling disconnected, feeling like nobody is there to have your back. And I think, at least in our context, eConsult has actually helped us avoid burnout because our providers feel like someone's got their back. They've got someone they can tap into, someone they can connect with, to talk about a patient who really doesn't want to come to the hospital, or maybe in the context of a search can't come to the hospital because it would just be a really, really bad idea. And so, you know, there is that increased workload on the PCP, but interestingly, during the pandemic, I think overall, if you take an aggregate, eConsult has actually helped with burnout because our PCPs haven't felt so alone.
Thanks, Dr. Gibney. I actually want to pick on Dr. Nambudiri, considering dermatology. And so many of us have seen great data around eConsult for dermatology, right? Like such a high volume specialty, but also with great efficacy in being able to respond via eConsult. So Dr. Nambudiri, do you feel that this is helpful in terms of just being able to manage that volume, or any comments on what you've experienced in dermatology?
Yeah, no, thank you for that question, and thanks for having us. Particular thanks to Michelle for doing such a great job on that presentation as well. I do think this is a tool that we've seen rapid acceptance of during the time of the pandemic. As Michelle pointed out, there was some adoption across our institutions of the use of eConsults, meaning a number of physicians were engaged with it, but it was actually a very small number, a very small minority of individuals. I think during the pandemic and the rapid transition over to various modalities for the virtual delivery of care, one of the nice things that people were able to appreciate was the efficiency of asynchronous visits and the effectiveness of them as well. And I think on the flip side, there was also a high buy-in or a high likability for patients to be able to get access in a timely manner that they hadn't previously appreciated. And so when you look at this from, you know, people talk about the triple or quadruple aims in healthcare and seeing where does this fit in, how is this aligned with improving patient experience and physician experience. I think there's a lot of really great synergy that comes out of this kind of care delivery. And so it's definitely something that, as a specialist viewing it from that standpoint, that I see a bright future for, and a lot of use cases. Michelle highlighted a few, but I think also in particular to Paul's point that he raised earlier about this idea of establishing connection with physicians and maintaining that relationship. My wife is a PCP, and she uses eConsults to reach out to various people, not me, because we don't work in the same health system, but she has other specialists that she can turn to. But she's also found it to be quite helpful and saves her patients time or an unnecessary trip to a consultant that, you know, can be addressed, that she can address herself and solve the patient's problem more quickly or more practically to allow them to save that kind of additional healthcare encounter down the road. So I would say we've seen a lot of really great uptick from the physicians that have been involved. And I think it's something that, you know, people maybe before they used it were sort of ambiguous or ambivalent, but once you're sort of thrust into the, okay, this is what we're going to do now, and you sort of have to run with it, people adapted very quickly and have liked the experience overall. And I will say there are also individuals for whom the eConsult happens, and the upshot is, no, we need to see you in person to be able to make a decision, right? So this isn't a complete replacement. It's a tool that may aid in sort of the diagnosis and management for some individuals, but ultimately functions as a triage for others, where you see something and you decide, no, this actually does require in-person care. You know, there's only so much I can do for a changing mole via an eConsult. At some point, I'm going to say, you know, really, in order for us to make a guaranteed diagnosis that this is or is not a skin cancer or a threat to your health, I will need to see you to come in. On the flip side, if someone comes to me with a changing lesion that is very obviously a benign lesion, I can save them, you know, the urgency to need to be able to come in and see me and go from there.
Thanks so much.
And Libby, if I could comment a little bit on the burnout, I'm going to take it from the specialist side. You know, Michelle talked about workload and workflow, and that as there's an increase of eConsults for the specialists, they can't be expected to work their full day seeing the same number of patients they've always seen, and then all of a sudden cram in 5, 10, 20 e-consults on top of that. So that's one thing that there might need to be some adjustments in the workflow. And the second thing is, Michelle, I like how you put it in terms of the competence. While eConsult, I think, improves the feelings of competence among the PCPs as far as how they can handle situations. I share an office with my pediatric dermatologist wife and hear her talk about the eConsult she gets. And I find there's times that she gets frustrated because a bad picture is sent with no information, no history, nothing that we know as physicians we need to make appropriate diagnoses. And I find herself like questioning, the advice she's giving because the picture is such poor quality and the lack of other information is there. So I think that leads to some frustration on the specialist side as well.
Thank you, Dr. Buchert. I have a couple of payment related questions, but they actually piggyback on what you were just saying, Dr. Buchert, and also Dr. Namadiri may be able to respond to these too. Just this quick response to this one. Can you discuss payment? Does a patient pay a copay for an e-consult? And this payment differs across states, but we can just generally say that Dr. Gibney and Dr. Tuo out of San Francisco and LA, patients do not pay a copay for an e-consult. This is not something that they are directly involved in since it's a peer-to-peer, provider-to-provider interaction. And I can throw this to Dr. Namadiri and Michelle. I believe there's no copay in your situation either for a patient receiving e-consult.
That's correct. There's to address Dr. Buchert's point about this sort of like incrementally just keep adding onto people's workload and asking them to do more with less or do more with the same. Each department at our institution has decided sort of how to handle both the administrative allocation and also the financial reimbursement aspects or compensation for eConsult. Typically, the model at our institution, which obviously is multiple hospitals and also multiple departments, multiple physicians in each specialty, not every physician is involved in eConsult from the specialist standpoint in terms of receiving or reviewing eConsults. So there's either kind of a pool of individuals who will take turns as the people responding to them, or sort of a like daily schedule of someone having either time carved out for being responsible to eConsults during X amount of time or X half day or what have you. And there is a formula or a kind of a reimbursement model, not at the level of a visit, but at some fraction thereof, let's say, that is accounted for, essentially counting towards some unit of productivity for that physician for doing e-consults with their time. Each department kind of handles that individually or independently, so I'm not really at liberty to speak to like the exact dynamics thereof, but that's roughly the model with which it works by.
Great, thank you. I do want to land on this topic just to make sure that we address it directly, that we had a wonderful conversation back in November at our annual meeting on eConsult and potential to address access and equity. And we know that this is not the solution to equity and access to care, but we know also that we've seen great uptake from federally qualified health centers, both rural and urban settings. And we know that this is a great opportunity to be able to provide patients with access to specialty care that they would not get otherwise. Also interesting topics that came up were that not everybody can do a live video visit. So if we think about telehealth, live video telehealth is not a solution for all either. So eConsult is one way to address patient need for access to care without having to directly involve patient in attending an appointment. But I'm not a clinician, so I welcome you, Dr. Tuo. Maybe you want to piggyback on that, just thoughts on how we can continue to think about eConsult and equity.
I don't know if I have much more to add. I think to your point, I think e-consults are one way to deliver specialty care. I think it's a great first step for everyone, to be perfectly honest. That way we can better triage and understand where that person can get their best next step of specialty care, whether it's in the primary care office, whether it's via telehealth, via video or phone, or ongoing e-visits with their specialists, or an in-person visit, right? So not only does it allow us to better identify the modality of specialty care that that patient should receive, but also the best timing. Is it next week? Is it tomorrow? Is it in 3 months from now when you get a repeat radiology test for that pulmonary nodule? Whereas an appointment next week would be fairly unhelpful for both the patient and the provider. So I think I like to think of it as one great first step for specialty care delivery. And again, I think useful for certain populations that we have a harder time to reach. So helpful for equity, but I don't want to think about it as just for our Medicaid patients.
Thank you so much. And I do want to wrap up, and maybe you have additional thoughts on that, Michelle and Vinod, but any final words just in wrapping up today? We really appreciate your time. Michelle?
No, I think this is a really, really good discussion that I really want to continue. And it's helpful to kind of hear from it both from the primary care provider and also the specialist perspective. And I appreciate those thoughts on kind of workload in the context of the pandemic, as well as equity and how this is ideally for all patients, although certain patients in particular might benefit more, but this would ideally be something that is offered for all patients.
Thank you, Michelle.
Yeah,
Any final words?
yeah, I agree with what Michelle just said. Thank you for having us here. I put my email into the chat, and I'm definitely more than happy to connect with anyone on this topic. I think it's so important and so interesting. And given that we're still relatively new to this space, I think there's a lot of opportunities to better understand what the impacts are, as we as healthcare as a system think about equity, think about how we manage disease and treat for all of our patients. I do think it's so important for us to keep that in mind and to actually rigorously answer the question, because I think that'll only further enhance or empower us to do more as we go further.
Thank you again. We have some other questions that are coming in that we'll answer by chat. I think these are really important, and we really appreciate we're getting questions from other states too. We started out as a good number of folks from California, and we've grown to be not just national but international. As Michelle and Vinod have pointed out, we have great research from Dr. Liddy up in Canada. She's not on today, but it's wonderful to see examples from other states, and we hope that we can see you on our future calls. We appreciate your research and your time today. And with that, please keep the questions coming in. We'll try to get our best responses to you. And if not, we can answer them offline. But in our last few minutes, we did want to point out a couple of pieces of research that have come up. And we shared these in our monthly eConsult news. You're all on our mailing list, and we appreciate, we do give you a lot of email, but that's because there's such great research that's coming out along the lines of eConsult efficiency and in this case, cost savings. So I'm not sure if Dr. Arfons, if you are still on, Lisa Arfons, I wanted you to speak a bit to what we saw come out from the VHA in the past month. Lisa, are you on?
I am. Can you hear me, Lily?
Yes, yes.
Very good. Thank you. Yes. So I am with the VA. I am actually an oncologist. I work out of Cleveland, but I am the acting deputy to the executive director for the Access Office right now. And I have been doing eConsults for many, many years, both when I was section chief, and then have taken obviously a much broader interest once I moved over to the Access Office as well. So VA has a lot of advantages, just to kind of follow up from what we were just talking about. I think it has a lot of advantages and that the data and impact might be a little bit more clean. We also have a much easier system to navigate. There's no real interoperability that we have to worry about in terms of communication between different providers. Everything is in one medical record across the country. And I also actually, when I was at the facility, primarily was actually from Cleveland doing e-consultation to one of our facilities in Michigan. So we also do not have some of the regulations, being a federal healthcare system, we don't really have the boundaries that others have with state and county and payer. So I do think that in terms of burnout, I agree that eConsults take time. The good thing is that they are workload generating. Therefore, at least for us, it is easy to measure RVUs. We are not primarily RVU driven, but I actually am able to do a calculation as to how long it takes me to do an eConsult, and then can, have discussions with our local leaders about how long it should take for me to do the number of consults we get every week, and actually subtract that from my face-to-face clinic time. We do have that demonstration of it impacting access, positively impacting access. And then, as you can see here, cost savings. So it's cost savings for the veteran, it is cost savings for the medical center, and it is obviously patient satisfaction if they are not driving to and from the medical center in their car that they're worried about, that needs gas, that they don't have money for, et cetera. And then if you can then avoid, obviously, unnecessary testing, which is really, I think, what the difference is in outpatient costs, was unnecessary testing, unnecessary visits with other providers. All of that obviously can have a major impact. So I think, and that's really what this shows. And it continues to show that even as we have grown, our eConsults work. We've been doing eConsults in the VA since late 2011, I suppose. And you can see the second study then does look at the massive increase in eConsult volume. I think from 12 to 18, there were just over 3 million eConsults that were delivered in that observational cohort study. And then finally, I think working with providers around burnout, I was section chief and doing all of the eConsults, and I would have my providers coming to me saying, I'm getting too many hematology consults, I want to do more oncology. And I showed them the data that 60 to 80% of our hematology consults for our section were being delivered by way of eConsults. And so once I think they saw the totality, not just their own practice, but from a population health management standpoint, how we were running our practice collectively to include eConsults, I think that changed their way of thinking, and they really recognized, I think, that they could be seeing a lot more hematology consults than they were, and so framing the discussion that way helped. And then finally, I think that if COVID has been a silver lining for anything, it has been obviously telehealth expansion, and not just telehealth, but I think all virtual care. And so if we can continue to ride on the coattails of virtual care expansion and continue to include eConsults within the compendium of healthcare delivery, as we suspect that we will obviously continue to evolve and grow virtual healthcare delivery, even knock on wood, once we are quote unquote post-COVID, I think that can only be beneficial then for eConsults in particular. So with that, I will go ahead and stop and take any questions.
Thanks, Dr. Arfons. I have one that is coming by chat, and I'm not sure if either Dr. Buchert or Dr. Arfons can respond from anecdotally how you might see this work. But this question is it appropriate to bill by radiologists for second read requests? And just the follow-up question on that would be that since radiology is not really a patient facing, radiology and pathology are not typical patient facing providers, how do you think about that or address that? And Greg, do you want to take that one? Do you have any thoughts on billing radiology?
Yeah, at least on a Medicaid plan, is that we will pay for second opinions, and quite frankly, I think that a second opinion by a radiologist is just the same as a second opinion by a cardiologist or an endocrinologist. And so, yes, we would be paying for those in general.
Thank you. And I see Delphine, you followed up on that too. So hopefully that does help with some of those responses. And Christy and Seema, if you want to follow up, we can do that offline and provide some examples of what we're hearing from our group too. Thank you, Lisa, for sharing this. I think what is wonderful about VA is that we can see examples of all ages of patients. We get a lot of questions around eConsult for the aging population. So for Medicare, for PACE, for long-term care. And so we wanted to focus our next call, our March work group call, on eConsult for the aging population. So we have a few examples lined up of what we'd like to share with you around eConsult and PACE and long-term care. and billing for Medicare, which is we get a lot of questions about. We also would love to share case studies of what you're seeing out there, what your programs are supporting in terms of delivering e-consults to elderly patients. So please share those with us. We would love to hear those. And I'm sure we'll be reaching out to VA to hear some of those examples too. Once again, I do want to thank our sponsors. If you are interested in sponsoring our work, you can reach out to us. Please do visit eConsultWorkgroup.com. And a lot of people want to see this presentation. Michelle and Vinod, your presentation was so great. Everyone wants the recording. So we will definitely get that posted to our website. And as we wrap up today, I just want to appreciate or share my appreciation for Senator Caballero joining us today. You have our link to our letter of support in your email. I will resend it to you again if you're able to participate. California stakeholders would like to participate by March 5th. We'd appreciate your support for our letter if you can do that. And please keep the great examples and great stories and publications coming our way. We appreciate all your input. And have a great day. Bye-bye now.
Thank you.
Thank you.
Thanks, Michelle. Thanks, Vinod.
Thank you, Libby. Thanks, everyone.
Thanks.